most famous physical therapist on the internet.
Hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heine, physical
And
therapist.
together we are the most famous physical therapists on the internet.
In our
What are you
opinion,
doing, waving to people?
Yeah, Bob, I'm reaching out to our audience.
All right, come on in. All right, let's go to work, Brad.
Okay, we're talking about sciatica, Bob. You know, you may get diagnosed with sciatica, or when you got that pain, some numbness, tingling running down your leg.
Right.
And there's certain levels the doctors or the therapist may refer to. Or you've got
certain levels of your back where the
Yeah.
nerve is coming from.
Exactly. We're going to show right here on Sam.
Sure.
And if they say you've got L4,
Right.
L stands for the lumbar spine. So we're going to show you that. And then 4,
There's
the level.
normally 5.
Yep.
Although a neurosurgeon just told me that they're seeing 6 vertebrae more and more.
Really?
Because women want to marry tall guys.
Why, Bob? Why? Oh, let's get on
That's
with
what
some.
he said.
What does he know? He's a surgeon.
You probably have 2.
Yeah, I'm going to get slapped. Okay, here we go. We're looking at Sam, the lumbar spine. Here's the sacrum, L5 right here, vertebra, L4. And so we're looking at this L5 would be the first space here.
Right.
And we got the red. Now, your nerve is yellow like these ones up here, but they're cut off. But I put red in there so you could see it a little better, I thought. And here we got it comes out here. It comes through the back here, through the pelvis. And this particular nerve actually runs up around
the front.
And then it goes medial or to the inside of the knee is where people typically feel the sensation.
Could it possibly be that this piece of tape represents it?
Right. Yeah. As a matter of fact, we have a purple piece of tape because Bob's a Viking fan, and we thought we'd oblige him with the purple. Why don't you stand up once, Bob? So this is where you may feel, and it's not exactly the strip, but this will be a general area around here and wraps to the medial side or the inside of the knee. It won't be over here because L5 runs over here.
Yeah, I think most people think of sciatica in the back of the leg, but it can occur in the front of the leg if it is up a little bit higher.
Right, exactly. And probably more of the sciatica is lower, the L5 or the S1 possibly.
Right.
Which
more
is
common.
Which is the back of the leg more.
Right.
So again, that's not exact science. It's just saying the general area. The next thing is manual muscle testing. And this is something that therapists or doctors will do very quickly. And you may not even know what they're doing if you're not familiar with it, but you will be now. So we're looking at the quadriceps strength. So Bob is going to kick out there. And this is, a therapist will always have the rolly stool around naturally. I'm going to test it by pushing here. Bob's going to hold, and if he can't and push it down, that may be an issue.
Right. It's normally a very strong muscle, so if you're able to break it by just using your muscles, it is like something wrong.
Right. And you can try this at home if you want to have someone do it to you, and then just have them go to the good leg that does have no symptoms, test that, and do the same thing. You can see I've got my hand under the knee here. That's how I like to brace. And sometimes I'll do it with the leg completely straight, push, and I'll say, bend your knee about 30 degrees, and I'll push it again. I do it at different levels. That's up to you. Now, the other one is walking on the heels.
You want to do reflexes?
No. Yeah. Well, let's stick to the manual muscle testing. And this one is done more frequently, I think, because it's much easier.
Yes, it's very simple to do.
So you'll just, the doctor or the therapist say, can you walk on your heels like this? And what that is doing is testing the strength of your anterior tib muscle. And it looks at
Which can be affected by L4 also.
Exactly. So those two are the two most common muscle groups manually tested for L4 level. Let's go to the next one, Bob. The patella reflex.
This is the one that people make fun of on shows and stuff like that.
Yeah.
They kick out.
Yeah, and they pretend to kick someone in the
exactly.
where. Anyways, but why don't you scoot back on the chair? When I do this, let's see, can we pull your pant leg up a little bit?
It helps to sometimes have a little roll towel on here.
Yeah, here, let's put this under there just so that so the leg kind of swings freely. Now, here's the patella, here's Bob's kneecap, and we're going to look at the tendon from the bottom of the kneecap to the tibia plateau here. And so it's only got about 1 inch long, and that's a soft spot in there. Now you can use a reflex hammer like this, and you find that, and we tap, and we look for a kick.
It's real subtle.
Yeah.
It's not like, well, sometimes it is the way.
Yeah. Well, there's one thing that you can do, and it works well. If I'm doing this and something like Bob's looking at it, and because he's thinking about it, you may not get an accurate test. Can you stop that, Bob?
Okay.
Now,
Try to stop
and
it.
people can do that without, they're just looking at it, and they're not going to let it go subconsciously or without it looking at it. So one trick that I like to do is go like this, Bob, and look straight ahead, and you pull apart.
That does enhance it quite often by doing this, and it makes it more.
Right. Yes. Yes. So if you can't get a reflex, have them do this. Or, sometimes you can put something there so don't look. I just say, look away, pull as hard as you can, and look down here now. Let's see if we can get it. Oh, look at that. So you got to stay away when they kick. Whoa, are you pulling, Bob?
No,
see, you're looking down, though. Look up. So he doesn't know when I'm going. And there we go. You can use your hand. I've done this when I have my reflex hammer and hit like that. Yep. And then, compare to the other leg. You'd roll that pant leg up. And then you'll see if there's a problem there. It looks really strong with this consistently in this leg. You're not having anything.
If you do it to somebody and they don't know what you're doing, that's often where you'll get a true response.
Right.
Because they don't know it's supposed to kick out.
Right. Exactly. Yeah. And if they get nervous because you got a little hammer in your hand.
Don't give Brad a weapon.
Oh, Bob, we lost her.
What'd I do?
So when we go through all these, if you're positive on all these, that still doesn't mean it's for sure L4, but it's a pretty good indication, particularly if you're, you've been doing this for a while. The experience makes a big difference. The other one is, and the last one we'll go through, is the straight leg test. This is also used for L5 and S1, but so I'm going to pull this down. Then this, you have to have a second person. So Bob's going to lie there. He's going to be relaxed. Here's the involved leg. We got the purple tape on it. The leg is going to stay straight. And actually, I'm going to do it on his good leg first. Knee is straight. I'm going to go up. Anything pulling, any pain?
Hamstring.
Okay, so he's got hamstring stretch. And if you feel that, I'm assuming here, not up here.
Right.
Okay. So that's normal. Now we're going to look at the involved leg or the suspicious leg. And you feel anything, Bob?
Yep, I'm feeling a little bit of funny in that purple area.
And then also when you get to the point, and we're at about 40 degrees here, which is a common place where you may find it. It varies. Add a little dorsiflexion or stretch here, and if that makes it worse, particularly if you might feel it up in here. You might feel it in the buttocks or the back. That's a very strong indication that we have a nerve that's being impinged or stretched, and a positive straight leg raise sign. So that's it. There is 4 different tests you can do to see if you are at L4. And again, these, you can try them at home, but again, they do take practice. It's best if there's a therapist or a doctor or a professional doing it, is a little more. And of course, you can get an MRI and, confirm it that way as well. But these are cheaper.
And remember, Brad and I can fix about anything.
Except for
a broken heart.
Very good. Good luck with your L4, L5, and even your S1.